We are here with health transformer extraordinaire, CEO and founder of Yosi, Prasad. Welcome. How are you, sir?
Very good, Unity. Great to be here.
Great to hear. So tell us about your vision for Yosi.
So what we've done is to identify key areas in healthcare delivery that requires efficiencies with new technology tools. So that's what we're bringing into provider workflows.
What was the genesis of Yosi? I know you had a personal experience at one point.
I spent over 10 years working in healthcare space for both payers and providers. So I've been very close to observing a lot of these efficiencies and workflow
Lots
issues.
of paper.
Lots of paper. So a year prior to founding Yosi, I had a dislocated shoulder where I went to an ER. The first thing I thought that was going to happen was someone was going to put my shoulder back in. But I was given a clipboard to fill out even before I could go see the doctor. So that and the experience past the ER incident. There were a lot of gaps in care. I didn't, as a patient, have access to a lot of information that I should have had. And I saw some of the issues and efficiencies on the provider side as well. So that's when we started the company to bring about those efficiencies.
So what's the transition been like coming from the healthcare industry for a decade and now being an entrepreneur innovating within that industry?
It's a great question. So now I'm on the other side of the table, trying to work with larger organizations and trying to bring about our innovation into those organizations. It's been quite challenging and very exciting because we're going back into these larger organizations, trying to find ways to implement our innovative solution. So we've found that experience to be pretty rewarding so far.
And what have some of the biggest challenges been?
Mostly it's been about larger organizations being open to challenges, in introducing new technologies. There's plenty of entrepreneurs that are transforming healthcare. So the key is to identify the appropriate solution for the appropriate organizations that you sell into.
So you got to break through, you got to get recognized, you got to have something that they need. How have you been doing that? So you're selling into health systems. Who do you go into in these organizations?
So typically, we sell into these larger provider organizations and independent, physician groups. So it's different for each of those market segments. With larger organizations, we typically work with the CIOs, the CTOs, and the CFOs who are making these business decisions. With smaller independent physicians group, it's usually the founders, physician owners, the chief operating officer for those organizations that we work with.
And what have some of your biggest lessons learned been? What have you learned now that you've been building, from the entrepreneur side of the table?
Do not overestimate the time that it takes to implement solution. Even the best case scenarios, right, takes longer to implement. So always be prepared to make realistic targets and goals for yourself and for the organization.
First you got to sell in, and then you got to implement, and they both take a long time.
Exactly.
Yeah. Wave a magic wand, take us into the future. What does that future look like when, as Yosi sort of achieves your moonshot of bringing the costs hopefully as close to zero as possible?
The way we imagine healthcare is, in a few years, we're not going to be seeing these clipboards in doctors' offices. Patients will have access to all of their health information that they need on their mobile devices, secure mobile devices. They'll be able to share and access their health records quite easily. And the care coordination, where we see a tremendous amount of gaps today, hopefully will be addressed where physicians can share patient information amongst each other.
Tell us the markets you're focused on. Are you mainly US based now? Are you thinking globally as well?
So as we've gotten quite a bit of traction in the US industry, now we have our first client in Ireland, and we're also talking to a few hospitals in the UK to implement the same technology that we've been very successful here with in the UK market. And most recently, we've generated some interest in Germany as well, because some of the themes or issues that we're addressing, improving workflows, it seems pretty consistent across borders.
Right.
all the providers are dealing with the same issues that we're dealing with here.
So what are you most excited about over the coming years?
So with the last 2 years, we've generated a lot of traction where we've now got tens of thousands of patients that are engaged in using our platform. So what we're looking for the next 2 years is to have Yosi implemented into more of the provider offices, provider organizations, streamline the patient experience and the workflow for those organizations.
And where should people go to learn more about Yosi and get in touch?
So we're at www.yosicare.com. We're on Twitter at YosiCare. That's our handle. We're listed on the Startup Health website as well as one of the health transformers.
And Yosi means?
I grew up in India. In my vernacular, Yosi literally translates to awareness. So we wanted to bring that into our healthcare experience here.
It's a beautiful word. Well, thank you, sir, for everything that you're doing to make the workflow of health and healthcare more efficient. Long way to go, but it's leaders like you that are fixing some of these challenges. So thank you.
Great, thank you.